but nothing is more motivating than fear, especially to parents. The infection is going to spread to your heart, they say. It'll go systemic, it'll spread to your bone. But is it accurate? This video series goes deep into the research on strep. If you missed part 1, you can check out that one, as it really sets the stage for why we even believe strep is the cause of any disease state, and it covers the research in great detail. Now in this video, part 2, we're going to go into antibiotics for strep. Do antibiotics work? And can we address these symptoms without antibiotics? One of the most common questions I get is, quote, how do I heal strep without antibiotics? Or what will work if I don't use antibiotics? So here's the thing, the definition of work matters here. What does work even mean in strep? Antibiotics can't work because working must mean you address the underlying issue. Antibiotics work like opiates work for pain. You might feel better, but nothing positive apart from some symptom relief was accomplished, and often damage is done. Killing off bugs doesn't even come close to addressing the issue because the bacteria are not only not the problem, they are the solution to a problem, as we covered in part 1. They are necessary to break down and bioremediate waste so it can be more safely removed from the system via the excretion pathways. We can very clearly observe this in all of the natural world, actually. Do antibiotics make some people temporarily feel better by reducing the inflammatory response? Yes, it does seem so. Does that mean they work, though? No. Can they be life-saving, as we are told in certain circumstances, such as in sepsis, maybe to buy some time for people? However, I'm not even so sure that it works even in sepsis, after I dug into the research on that. But that's for another video that I'll cover later, so stay tuned for that, as it's one of my favorite topics. But this is why it's impossible to answer the question of how to get rid of strep without antibiotics, or, quote, natural remedies for strep. You can find so-called natural remedies all day long for strep or any other perceived problem on the internet. However, until one understands that the microbe found at the site of supposed infection is not the cause of any disease, then he or she is going to continue to fall back into the paradigm of conventional thinking and continue to feel they needed to take that next round of antibiotics as nothing else seemed to work. The question is, what behaviors and actions led to the imbalance in the first place? Almost always, parents that deal with so-called strep infections with their children have vaccinated their kids or have given antibiotics for other things in the past, often many rounds, or used other harmful treatments. This alone sets the stage for recurring problems. They often don't understand fevers or the need for the healing response, and they have a history of using fever reducers. They don't understand that all of the acute symptoms that present, albeit uncomfortable and uncomfortable to watch, are the healing responses. These faulty approaches and treatments alone contribute to the very symptoms we call strep and place additional need for more and more microbes to clean up that waste and clean up that damage that has been suppressed. So the cycle continues to repeat, and symptoms often will worsen over time. Currently, most people approach the body today in the form of, well, I have symptoms and symptoms are bad and they're uncomfortable, and how do I kill off the bad bacteria that seem to cause my symptoms or that I'm told cause my symptoms? But the fact that this model doesn't work is so very clear, even in modern medicine, even by their own admission. Of course, they won't acknowledge or even investigate that the original premise is faulty or inaccurate, but they will admit that there are long-term consequences to using antibiotics. So my question is, why do we continue to partake? Why do we continue to take them? Of course we know the answer: fear. Even medical doctors know that antibiotics create long-term issues, and the research speaks to this as well over and over, but nothing is more motivating than fear, especially to parents. The infection is going to spread to your heart, they say. It'll go systemic, it'll spread to your bone. Most people are so out of tune with their own body's self-healing mechanisms that they think that, it could spread, that the spread narrative is feasible, because they've heard it all of their lives. We all have. But is it accurate? Using pharmaceuticals, specifically antibiotics, has robbed us of a genuine experience of true healing. The time it takes, the discomfort, witnessing the body do what it's designed to do, microbes included. It heals, it restores, recovers, and it does it all on its own. Instead, we chomp at the bit, we cut that process off at the knees, we're fearful, we're impatient, succumbing to the very approach that we claim we wanted to avoid, and we end up taking those antibiotics after all. Why do we keep doing it? Why do we return to it? Why do we run back to that old, outdated model? It's because even though there's a part of us that knows it's not the way, a larger part still buys into it. That need comes from having little to no real understanding in how the body heals itself, the way it heals itself, and how in almost all cases it will do that beautifully well unless too much damage has occurred along the way or in severe trauma or injury. Many haven't taken those steps to really explore that on their own, so they don't trust their own body. They're so used to taking pills and pharmaceuticals to suppress their symptoms. This is why they continue to go back to the antibiotics or the pharmaceuticals even when they claim they don't want to. So let's take a look at what the research says about antibiotics and strep. First paper, different antibiotic treatments for group A strep pharyngitis. This is a 2021 meta-analysis. It included 19 trials reported in 18 publications. This is an updated review, first published in 2010, then again in 2013, then again in 2016, and then 2020. So you can see this is not cherry picking. This is a wide scope review over many of the trials that we have. The study assessed how different antibiotics compared to penicillin. Penicillin is the antibiotic of choice for strep, and keep in mind, most research efforts will not do a placebo-controlled group compared to an antibiotic group because they believe or claim it is unethical to do so. So keep that in mind. It really makes it impossible or very difficult to adequately establish if people who do not take antibiotics at all do better than those who take antibiotics long term. We don't really know the answer to that. The authors concluded that, quote, there is insufficient evidence to draw conclusions regarding other comparisons in this view. Data on complications were too scarce to draw conclusions. These results do not demonstrate that other antibiotics are more effective than penicillin in the treatment of group A strep. So they're saying that all the antibiotics seem to be about equally as effective based on their parameters. Let's take a look at table 1 of this review and see what trials they included. They state that, quote, the methodological quality of the studies in general was poor. 9 out of 10 studies, and you can see those there, reviewed dated back to the 1950s when randomized trial methods were still evolving and good guidelines for conducting trials were not yet available, end quote. Also interesting, even in this review, they note that, quote, in other parts of the world, the incidence of acute rheumatic fever, supposedly caused by strep, is so low that the risks of antibiotic use may outweigh the potential benefits, end quote. So they're saying that in most countries where the incidence is so low, the risks of antibiotics are actually greater than the benefits that they would provide someone. And as we'll get into, rheumatic fever is extremely rare in industrialized countries, and it's more prominent in poor countries. You'd think that this is due to lack of access to antibiotics, right? But if you thought that, you would be wrong. The decrease in rheumatic fever occurred before antibiotics were ever introduced, and we'll get into this later. The next review was done in 2012 and looked at randomized controlled trials comparing short-term oral antibiotics to standard duration oral penicillin in children. They wrote, quote, 3 to 6 days of oral antibiotics had comparable efficacy compared to the standard duration 10-day course of penicillin in treating acute group A strep. So in other words, taking antibiotics for a short period of time had the same outcome as longer runs. Keep in mind that according to these authors, again, quote, placebo-controlled trials could be considered unethical. This means that we don't really know if people do just fine without any antibiotics at all. After all, short doses are comparable to long doses. Well, I wonder what would happen if we had no dose. The studies simply compare one antibiotic with another. Now here's another comprehensive review done in 1985 called Sore Throat, Antibiotics, and Rheumatic Fever. The researchers note, quote, while widespread antibiotic use for acute upper respiratory tract illness may have had some effect, the decline in incidence of rheumatic fever began prior to the availability and use of effective antibiotics. Further, the use of antibiotics for treatment of acute sore throat has been shown to be at best suboptimal. Okay, listen to what they're saying. I'm not saying this. That the antibiotics for treatment of acute sore throat has been shown to be at best suboptimal and at worst haphazard, and the compliance of patients with appropriately prescribed oral medication is unknown, end quote. As I mentioned earlier, many people have been led to believe that the complications of rheumatic fever and this idea of strep spreading to the heart have declined because of the use of antibiotics. But that's not the case. They declined prior to the use of antibiotics, so we can really let that story go. They also say clearly that antibiotics for sore throat is not even optimal. Quote, the role of antibiotics in the symptomatic treatment of pharyngitis is uncertain and continues to be debated. Brumfitt conducted a randomized trial of penicillin in British servicemen with sore throat and fever, 67% of whom had positive throat cultures. Penicillin treatment produced significant shortening of the duration of fever, sore throat, and pharyngeal infection, reducing the duration of the illness overall by, get this, 24 hours, end quote. So in other words, if you want to reduce your symptoms by a big whopping whole day, then take those antibiotics. That's according to one study, that is. They go on to write, quote, Havercorn, however, found that penicillin did not eradicate the signs and symptoms of strep pharyngitis better than symptomatic treatment alone. And Peter does not regard antibiotic administration justified for symptomatic relief, given that strep pharyngitis is a self-limiting disease lasting less than 5 days. A leading article in the British Medical Journal commented similarly that penicillin treatment had no dramatic effect on clinical course of acute illness. Did you catch that? Antibiotics had no effect on the clinical course of the illness. Moving on, more from this review, quote, Howie and Fago noted almost equal numbers of cases of rheumatic fever in those who received antibiotic treatment for an acute sore throat and those who either had no history of sore throat or those with minimal symptoms and who did not seek medical treatment, end quote. This means that they found that rheumatic fever shows up essentially equally in those who get antibiotic treatment and those who didn't. This would make sense considering there is no evidence that rheumatic fever is actually caused by strep in the first place. And lastly, they state that, quote, indeed, medical treatment of acute sore throat may today have no influence on the risk of developing rheumatic fever, end quote. And isn't it interesting that most clinical recommendations found easily online state that antibiotics should be given even when the culture results do not confirm the presence of group A strep. So even when the bacteria are not there, take those antibiotics anyway. That's what you'll see on the top pages of Google, but that is not reflected in the literature. Now, can antibiotics work at least to suppress some symptoms in other ways than just killing bugs off? This does seem to be the case. Quote, a number of studies since the 1990s have contributed to the idea that some antibiotics might also directly limit or change the inflammatory response, as discussed in the December 2007 issue of Rhinology. Several classes of antibiotics, including the macrolides, the tetracyclines, and the beta-lactams, when used in certain chronic illnesses, appeared to decrease inflammation, end quote. And take a look at this article here that reports on these studies as well. Antibiotics may improve depressive symptoms in people with low-level inflammation. Patients with higher C-reactive protein levels, indicating low-grade inflammation, showed greater improvement in their depressive symptoms when taking minocycline. Taking antibiotics don't appear to work if working means addressing any true cause of a disease state. In fact, they appear to compound the issues in many cases, causing long-term ill effects. These drugs, if at all useful, should be used when literally all other avenues have been exhausted. And even then, I'm not so sure that they're really helpful in all the studies that I've read, especially in cases of sepsis. Now, in the next video, like I said, we'll talk about rheumatic heart disease in great detail, since this is the major reason people have their kids taking antibiotics, because they fear it's going to spread to their heart. That's what they're told. But before I sign off here, I want to talk quickly about this idea that shows up all the time in the research and in the media, and that is the scary asymptomatic carrier the asymptomatic spreader of strep. And that is the kid that goes to school, appears healthy, but is somehow spreading his dirty little germs, his strepy germs, to all the other kids, getting them sick. Now, is this a real thing? Is this something to really be concerned about? This is the very premise for treating children prophylactically, meaning treating children before any symptoms show using antibiotics, just in case. We know that both healthy and sick individuals carry this bacteria. We know that even after people are treated with antibiotics, many still have that bacteria. So what gives? If it is the bacteria that is so deadly, why do most of us walk around with it with no issues whatsoever? In a 2014 systematic review in the Journal of Pediatric Infectious Diseases, the researchers write, quote, "Despite the common nature of group A strep, the carrier state of this organism is not understood," end quote. Another section of this review said researchers performed throat cultures and serology on over 300 individuals. Nearly 20% of the patients who were treated with either oral penicillin or intramuscular penicillin continue to harbor the same strain of group A strep in their throats after a course of antibiotics. In addition, nearly half of the children who experienced a microbiological treatment failure continue to have a positive throat culture with an identical strain after a second course, and 42% were positive after a third course of penicillin. They try to give different hypotheses on why there is so much discrepancy on who actually is a carrier and why treatments with antibiotics so often fails. One well-known theory is that some of the normal bacterial flora of the pharynx and tonsils produce an enzyme called beta-lactamase that blocks the strep bacteria from antibiotics killing them. Now, regarding this theory, you'll see all over the internet, they still use this theory to this day, but it's highly controversial, and the research shows us. The authors of the review go on to say, quote, "However, this theory has been controversial and conflicting results are reported in other investigations that have found no association between the presence of beta-lactamase producing organisms and penicillin treatment failure, nor higher eradication rates with beta-lactamase stable antimicrobials." End quote. In other words, this hypothesis is also not a solid one according to the literature. Other theories involve that the germ goes intracellularly to hide or hides in biofilms, but of course, they don't have any logical proof of this either. It may be no surprise to you by now that somehow their line of thought never considers that the bacteria may not be the issue at all. They never question the original premise, even though they continue to run into problems with their own hypotheses continuously. This really is the definition of pseudoscience. A legitimate scientific process must question its original premise. It must entertain that the model may be wrong, especially if there are conflicting results. But they don't question it, even when a few scientists, and there are some, that point out the major issues with the model. Those are lost in the sea of the majority who press on with the conventional understanding, even despite lacking evidence. Now, back to the strep and the asymptomatic spreader of strep. The review researchers concluded, quote, "In the clinical setting, there is no practical way to differentiate the carrier from the person with acute infection, meaning the asymptomatic spreader with the person who has an actual infection. There's no way to differentiate that clinically." That is according to this review. Bottom line, they have no real clue. Healthy people have the bacteria, unhealthy ones do too. But here we are treating kids with drugs that have multiple long-term ramifications without any sound reason at all. Even when said treatments don't get rid of the big bad bug that they claim is the cause, it's almost like the bacteria is supposed to be there and will change, shift, morph based on its environment. Now, how is that for a change in theory or concept?